Hello, everyone. Welcome. So, we're talking today about animal companion death care, and I'm really honored and thrilled to introduce Dr. Liz Andree from Sunset Veterinary Care, as well as Barry Lachuta from Peaceful Pasture Pet Cremation. I will get it right one day. And myself, I'm Michelle Stokotelny. I am an animal companion death doula or end of life doula, whatever term you prefer. And so tonight we're just having a casual conversation about what animal death care and companionship, everything else, what that means and what we can offer you. There are a number of emerging, death doulas who are interested in animal companion death care, and there are a number of, veterinary clinics that are, that specialize in helping people plan for end of life with your animal companions. And so each of us is going to share a little bit about our specialties. And, the one thing I love about this is that we are, we can be like a team. And that's what's needed, especially just like with humans, animal companions deserve the care and compassion that we can provide. And so, as an animal companion death doula, and I forgot to also mention, you're more than welcome at any point to write questions in the chat. We are going to open up the floor for questions in a little bit. We're just going to share a little bit about our professions and our experience first. As an animal companion death doula, my job is to help families either prepare for end of life with their animal companion or to even do advanced care planning. So these are two different realms. Sometimes I'm called in to help with end of life care in a non medical way. Death doulas, end of life doulas, we're there for the non medical support. So this can look like planning a vigil, if there is, if the animal companion isn't going to be needing the services that Dr. Liz provides, but possibly going through active dying phase. Or if, even if we are, calling in a professional like Dr. Liz to perform that service, we can still plan a very meaningful and beautiful vigil that can really help the family, meet that time with, a great deal of compassion and love and healing and peacefulness. Um, and so sometimes we can be called in for, even before there's a life-limiting illness that is, happening. Sometimes we have advancing age with an animal companion, and we simply know that, it might not be today, might not be tomorrow, but this is something we need to think about. And just like, death doulas will say, please advance care plan as a human, you can advance care plan for your animal companions. And this tends to alleviate some of the stress that we can feel when we are facing deep grief as we say goodbye to our animal companions. So we can look at, end of life care, what we're hoping for in terms of what can we provide to our wonderful animal friend to ensure that there is, the kind of medical care that they require, as well as what comes after that, which is what Barry is going to be discussing with us today. A very amazing, you know, more ecological type of cremation called aquamation. And so he's going to share a bit about that later on. And so just to walk you through a typical visit, if I'm called into to a family's home, obviously post-pandemic at this point, but we can also do this via Zoom, which I have been doing since the pandemic started. Uh, we go in and we just simply have a discussion, what is going on and what can we do, where do we go from here? Sometimes people are having a very difficult time to make decisions because they don't know. Sometimes the decline in an animal companion's health is so gradual that, you know, unless you see the animal only once in a while, you might not notice the decline that's occurring. And so, you think, okay, well, they might be a little bit slower, maybe they're not eating as much, but they're still eating a little bit, and so it becomes very difficult. The lines are a little bit blurred as to when and, when are we going to think about what comes next? When is like, where's my bottom line in terms of my animal companions' quality of life? And so I bring in a questionnaire. We just have a conversation about, where do you feel about these specific aspects in terms of how they're eating, how they're sleeping, where their pain level seems to be at and what we've done so far. And of course, all of my suggestions or all of my resources aren't going to be in the medical field. And so, of course, when we kind of determine where we're at with each specific case, that's where the recommendations for, calling in someone wonderful like Dr. Liz might come into play, where, we need to have a medical assessment and, so you can be given options as to what end of life care might look like for your specific animal companion. And even with that, even if it's not, coming up too soon, it's also very advisable to talk with somebody like Barry about advanced care planning for after the death has taken place. So what I'd like to do is let Liz have a chance to share with you a little bit about her experience and what she offers. I find her to be an extremely compassionate individual. And so I'm going to hand this over to you, Liz, if you'd like to share.
Thank you so much, Michelle. I guess just to talk a little bit about myself and what I offer, and then go into a bit about what a visit with me would look like. I really appreciate the things that Michelle is saying as far as getting more knowledge out to people to understand that you can really pre-plan and help to alleviate a lot of the stress that comes at the time of your pet's passing, to be able to feel more prepared, that it doesn't feel like you have to make all these decisions in such a constraint where we have a lot more emotions and a lot less time to make the decision. So having resources like Michelle to be able to help families during that early stages to make sure that they get exactly what they're hoping for. So where my role would come in is to be able to provide the medical aspect, so being able to provide a medical opinion as well as provide medical services that are required. So I do offer an assessment right now for quality of life, which goes into some of the similar things that Michelle is talking about, as far as, looking at some of the different things that might kind of be a suggestion that the companion is having some difficulties. But where I would have something differing is that I can also complete a physical exam and kind of check over the companion head to toe to be able to see, what am I seeing? Is there anything that's sticking out to me that looks like some illness or something that I would be concerned about would be causing pain? We work through a worksheet that has different indications to let us know how animals show us pain. So of course, they're not going to outwardly say like, my knee hurts, or, this area of my body hurts. So there's different things that we can look at, from as simple as just how they hold their whiskers, how their tail is positioned, that might be suggesting to us that they're not as comfortable as they were as a younger little creature. So during that assessment, I usually spend about an hour of time. Because there is an exam component to it, I am still currently offering those in home for families, so that I can be there. And on occasion, it's appropriate for us to look at other options, so things like medications to help with pain relief. So I am able to write prescriptions, usually to family veterinarians, to be able to for families to go pick up from their regular vet, but at least they've saved kind of that trip for their companion that might be really stressed or have a really hard time getting in or out of their vehicle. I am also certified in animal hospice and palliative care. At this time, I'm not really taking on new patients for the hospice and palliative care, just simply because of time constraints. I'm looking to hopefully add some more veterinarians into my service in the coming probably 6 to 12 months to be able to expand that a little bit more. But animal hospice and palliative care is maybe not as extensive as what we can offer for people, because we don't have, like a hospice center or anything like that, where we can have everybody kind of in one space. But essentially, a lot of it is really helping families support their animals at home and supporting everything about their animals. So a lot of the times in medicine, both human and veterinary, I think you get so caught up in looking at the numbers and trying to control to get this level to this, that we sometimes maybe miss the patient as a whole. So the idea between hospice and palliative care is that we're going to be able to support all parts of this being to make sure that they're as comfortable as possible, and pain management is really high up there. But from a veterinary standpoint, I'm able to go into a home and maybe help make adjustments. So if they're having difficulties on stairs, suggesting things like ramps, or being able to teach them how to do fluid therapy at home, things like that. So I'm really hopeful that that's something that can be added in more depth in the next few months. But what is probably the biggest part of my service right now is providing at-home euthanasia. So this is veterinary assisted death for animals. During my visits, I say to families that our top priority is, of course, we'll use Fluffy for a name here. Our top priority, of course, today is Fluffy, but I'm here to support you as well. So I want to make sure everyone is as comfortable as possible. So if anyone needs more time or space, I'm here to provide that for you. I schedule my appointments to give me, if I really need it, up to 2 hours, but I find most families need around 45 minutes to an hour of time, but there are people that need more time. So I do try to make sure that I can accommodate those that need it. But during that visit, when I first come in, I'll greet my little cat or dog patient. If they're eating, I have really high value treats that they might be interested in. A lot of the times they're at a stage where they're not really interested in eating anymore. I give medications to my patients to help them relax. So it's usually a combination of some pain relief and some sedatives. So I describe it as that it helps relax the mind and then the body so that they can really just be at a restful peace before we proceed with the euthanasia medication. And I think that's sometimes easier for families too, to be able to sit with their companion while they slowly over 15 minutes relax and kind of can be, in their comfortable space before we proceed with the euthanasia medication. I try to be as open about everything as possible, but I do also recognize that a lot of people are uncomfortable with anything that's very medical, especially in their home. So I do try to use little blankets to shield anything, just to make sure that everyone is comfortable during our time together. And that wherever their little animal is comfortable, that's where we will go. So I have been on beds, I have been under a table, I've been in the backseat of a car, I've been outside, I've been in a basement. I will really truly go wherever is most comfortable for the dog or cat, because I don't want them to be forced to move somewhere at a time when they're already probably having some difficulties. I do help families collect any sort of memorial items they might want. So I make paw prints if there's any fur that they like to have clipped, those sorts of things. And then I, of course, give them time with their animal, but I then do help arrange aftercare for families. So I will transport pets home to me, where then the crematorium will come to me. So this is where Barry, I think, becomes involved, that he'll come meet me at my home to be able to continue the care for these little creatures.
Thank you so much, Dr. Liz. I think that was very informative. Um, yeah, so yeah, this is a great time for us to introduce Barry. So I've met Barry at several of the animal companion death cafes that I host. And if you've never been to one, I highly recommend them. They're a great place to, just like the human death cafes, to talk about death and dying, with regards to our animal companions. It's something that, we often don't talk about enough. We kind of accept it as, well, this is a part of our life, and it is, but we don't discuss it and its implications and what it means to us. I have a background in counseling, and so I'm often talking with people in their deep grief. And so one of the things that seems almost like the most taboo thing to say is that sometimes saying goodbye to an animal companion seems a lot harder for many than some of the human losses that they've had. And it almost seems like we don't honor that, the fact that our animal companions aren't just, these beings that we just feed and sometimes play with. They are our family, and we need to honor that relationship so much. And the reason I wanted to have this animal companion death care conversation today is because the more that we get it out there that this is very significant, this is a significant part of all of our lives, not just for the animal, but for all of us who love those animals. And when we start to treat it as such, then we almost kind of open the door more for normalizing the grief that comes with it. When we say goodbye to an animal companion, whether they've been with us for 2 or 3 weeks, months, or 20 years, the length of time doesn't matter. It's the impact they've made on our lives, and the mark, their little paw print on our heart, or not always paws, I guess wings or talons, depending on what kind of animal we're talking about. But we love them all. It doesn't matter. Um, and so I want to normalize these discussions as much as possible so that we start to feel comfortable expressing what it means. Even anticipatory loss, or sorry, anticipatory grief rather, is really significant when it comes to especially our animal companions. We experience that often with humans as well, but sometimes obviously we need to call in Dr. Liz or veterinary care to provide euthanasia. And that is something that weighs very heavily on almost anyone who's ever loved an animal and has had to make that decision. And so by having more information and not having to make that decision, in a matter of hours or days, because all of a sudden our animal companion who may have had maybe a life-limiting illness for several years, but all of a sudden has gone on a steep decline, and now we have to make this decision very quickly, we feel ill prepared. But when we are able to talk with professionals, have the support, whether medical and non-medical, we feel a little bit more stable with regards to what we're about to face. We have the support and the resources. We have things set up. We know that, for instance, working as a team, possibly, if I've been there with the family and they've already been introduced to Dr. Liz, and they know that once Dr. Liz is done with the euthanasia and the family has had time to say goodbye for as long as they need to, and she takes their animal companion home, and then Barry comes to get, everyone is involved, and all of that was set up prior. That alleviates a lot of the stress of having to make these decisions, as Dr. Liz said, while you're already in deep immense grief or even shock. I mean, accidents happen, unfortunately, and if an animal got hit by a car and all of that, like all of a sudden you're having to make these decisions that you never prepared for, and it makes the grief that much harder. And so even if you have a very healthy young animal companion, it doesn't hurt to advance care plan, and that can mean just even writing down, if my animal were to be struck in an accident, at what point do we say, do not resuscitate, or no more life-saving measures? Or at what point do we say, now we need to discuss end-of-life care? We don't know what we don't know. We don't know what's going to happen. And so much like with humans, and I highly recommend all of this discussion for humans as well. Obviously, we need to think about, end-of-life care, or what our wishes are. It doesn't always mean we get everything that we're hoping for, but at least then we have an idea. It alleviates a bit of that stress and worry about what might be, when we have made it very obviously clear to those that we love what our wishes are. And so in saying all of this, I want to hand it over to Barry, who has a beautiful area outside for, well, I'll let him tell you more about all of that. But I love what he does. I feel like him and his family are very compassionate people who care deeply about the animals that they welcome into their home for this particular process. And so, Barry, I'm going to hand it over to you. Thank you so much for being here. Gotta unmute. Hello?
Thanks, Michelle. I appreciate being able to attend another one of the pet companions. I'll talk a little bit about where my crematorium is set up. We live in Lachuta, and I service the area in Lachuta, and I also deal with Winnipeg. So there's surrounding areas in Winnipeg that I'll go and pick up, whether it be in home euthanasia, or it's like you mentioned about the accidents happening. I'll get phone calls about an accident happening, and the people are luckily have heard about my business, and I'm able to go in and pick up their animal and go through very brief things. I try not to get into much detail when there's accidents and stuff like that, just because of the fact it's just really hard. So I bring them back. In Lachuta, the crematorium, we have a morning room that people can use too. So I really like when people come down to the crematorium so they can use that morning room where they can spend time with their pets before the process. There's quite a few people that are interested in my process. So when they do come down, I'm able to give a very quick tour of the machine and everything that's involved with the process. And I think a lot of people appreciate that because of everything being environmentally friendly, everything, my process, everything is usable. Even the end product is usable. I researched it for a year and a half. The whole aquamation idea has been around for a very long time in the US. There's 5 of us in Canada now that we speak to. I kind of reach out to a couple. There's a couple in Ontario that are newer, and they're just getting their feet wet. So there's a lot in the US that I reach out to. There's one in the Netherlands. So it's getting more and more popular for pets. Human, there's 2, I believe, one that do human aquamation, alkaline hydrolysis, that's in Prince Albert, Saskatchewan, and there's another one that does humans in Montreal. So hopefully over time, people will see the benefit of how aquamation is, and there's just more available throughout Canada. So that I talk a little bit about our location, what we do. We also, like Dr. Liz does with the paw prints and fur clippings, I get my 60-year-old daughter is the one that does that in our business here. She takes care of it's a family business, and that's definitely her thing. Like, I can't do anything until she gets home from school. And so everything here is we all kind of contribute. So it's a small family run business. And I'm just thankful that you have stuff like this so I can get the education out there that there's another option besides flame cremation that exists in Manitoba. I currently deal with 4 vet clinics, Dr. Liz being one of them, and I really like the idea of the in-home euthanasia. That there's so many benefits that Dr. Liz has with the pet being around its own surroundings. The whole family can spend time, as opposed to what's happening in vet clinics now with COVID and everything. And that's mainly the things that I deal with is in-home pickups, vet pickups with the 4 that I mentioned that I deal with. And yeah, other than that, the benefits are aquamation is 1/10 the carbon footprint of flame cremation. Everything that when I set up the machine and run a process, once the machine is full with water, that water circulates the whole time. I don't use any more water than that's in there, and it circulates for 20 hours. Usually the process is complete. Then the remains are dried and processed, just like flame cremation, with the bones and stuff made into ash. And then afterwards, whatever the person chooses to put the remains in, be it my biodegradable urns that are included in my private service, aquamation service, or what they might even have something that they have at home that they want the pet in, which is nice too. And I just switch it over. If they bring it to me, I'm able to do it at the crematorium, or since I'm in the city quite often, I could just pick it up at the residence. So that's pretty much the service that I do. And pre-planning is huge. You both talk about, and I think that's so important. Once a person goes to the vet clinic or whatever, and it's just it's just so stressful for everybody. And it's just the choices, like people are grieving so hard. I've had a call a couple days later, and they had a chance to think, and they'll change, you know, an opinion of an urn they had or something like that. So again, I can't stress how important pre-planning is when we're dealing with grieving. Animals are so fantastic, and it's hard. And I'm just glad to be a part of the process.
Thank you so much, Barry. It really helps to hear, you know, your perspective. And, you know, I think all of us have our different experiences and stories that we could share where, you know, we see what happens, the aftermath of not pre-planning. And it doesn't mean that, you know, that pre-planning prevents us from feeling that deep, immense grief. It doesn't at all. We're going to be grieving, obviously, one way or the other, but it does alleviate a certain amount of the stress and the decision making that one has to make when in deep shock. And even with a planned, you know, euthanasia with regards to animal companions, it doesn't, you know, there always is, you know, that initial shock of that loss. And so pre-planning can't be encouraged enough. And I hope that more and more people will start to think of it not only for themselves, but for their animal companions. And so I want to thank Barry and Dr. Liz for sharing so much about their services and what they offer. And I want to open the floor now for anyone that has any questions. Feel free to unmute and let us know what you would like to know about, or if you want to share anything about what we've said.
I'll go.
Hi, Helen.
Hi. So Barry, how did you find out how to get involved in that? Like, I'm out in northwestern Ontario, so I'm just between Dryden and Kenora. And so I seriously don't even know what our vets offer. I do know that for sure, no, I shouldn't say that. What I believe happens is that our animals are kept for almost a week, sometimes at our vet, and then sent to Winnipeg to be cremated for those that choose that route. So I'm just curious as to, like, because they have been talking about setting up a crematorium that would work for a flame crematorium in Dryden, but they're having opposition right now because they want it fairly close, like in town limits, and there's a lot of opposition right now. So I'm just curious about the cremation.
Yeah, no, there's 2 locations in Ontario. If there's a way that you can email me, I can give you the contact information. New Leaf, I'll get the name perfectly. I reached out to him the other day, and I'm not. He's in Ontario too. That's awful that it has to be shipped to Winnipeg to be processed. Your pet. Yeah, so there's actually there's 2 in Ontario, and like I said, if you can message me I can give you the location and the contact for him. And that's one thing that dealing with vet clinics it is tough. You're right, they do sit there for that amount of time. That's a nice thing about what I like doing is I like going, and especially with Dr. Liz, where she's doing in-home visits and being there part of the team that we've made. I can take the pet home right away and process it a lot quickly, and then within days I'm back in the city again doing the same thing. That's why I really enjoy the home pickups and everything like that. Absolutely.
Right. Yeah, that's great. Yeah, I'd be just totally interested in more about what that is, and like, so tell me where Lac du Bonnet is again. I know it, but yet I'm trying to visualize where it's located as far as Winnipeg.
It's an hour and a little bit northeast of Winnipeg. It's past Beausejour.
Okay.
Yeah, so that's where we're located. But again, I drive into the city. I deal with the city, and I was debating whether to go. Kenora isn't too far from us. It's about a 2-hour drive.
Yeah, and I'm another hour east or west. No, try that one. I'm east. I'm an hour east of Kenora. Yeah.
Yeah. Okay. So yeah, they definitely. Ontario's huge, and I know of the 2. So hopefully more get out that way. Definitely.
Yeah. I'd just definitely be interested in that. That's cool. Thanks.
Yeah, if you can just send me an email. I think Michelle's going to send out our contact information later. that you
Okay.
can link on, and I can give you his name and number, and hopefully that it will work out that way, because I just hope more and more across Canada is able to provide aquamation, because of the benefits are just phenomenal. Like the remains that I get is 20% more than flame cremation. It's just yeah, like I
Yeah.
just can't
Do you
talk
mind
enough
telling
good
me
about
how
it.
much it was of an investment for you to get going into it?
I'm sorry.
How much of an investment was it for you to create your business?
Well, because of the machines come down from Indiana, so it's the exchange that is tough for us Canadians. Yeah, it's with it. Yeah, it's to get it here and stuff like that. The machine alone and everything, you're looking at probably about 150,000,
Oh, okay.
and that's for a smaller machine that I have. There's
Okay.
bigger ones, obviously, and stuff. But yeah, that's just for the machine and the equipment you need. Like that's about
It's
right.
an investment.
Yes, absolutely. So that's why you do so much research into it, and make sure that it's going to be, what my area needs, and what really my province needs, definitely. And just
Right.
to have another option, right, to flame, I think is important.
Yeah, for sure. No, I didn't realize anybody was doing it in our, like, to me, you're in our area, like Winnipeg doesn't seem far for us, so.
Well, yeah, well, especially if he's transporting them there anyways, definitely
Mhm.
it's within travel isn't that bad anymore, no.
No, when we're allowed to.
Well, right. There's more restrictions tonight as I'm talking, actually.
Yeah,
So
yeah. Well, thank you for that. Yeah, I'll definitely be in touch. Thank you.
Perfect. Thank you so much, Helen. And Amy asked a question to you too, Barry. I'm gonna ask it out loud right away. I'm so sorry. Um, phones, right? But one of the things I also wanted to mention is, much like I do offer with humans, I offer a 60-minute consultation free of charge, where I also do that for animal companions too, where we go through a checklist and you receive resources and information. My biggest thing right now is getting out there, getting information out there, getting people, to know what is available to you and what the options are. It doesn't mean that you're going to choose all of those options, but it's nice to have the options to at least refer to when you need them. So if you're ever at that point where you're thinking, I'm not sure if this is something I need to think about, feel free to send me a message and let me know that you just want a Zoom chat, and we'll talk, and I'll provide resources for you, as well as like a little checklist, or some worksheets to kind of start thinking about what end of life care might look like for your animal companion. And so Barry, Amy asked, it says that you mentioned that you offer a tour with COVID restrictions. Would you still be able to offer a virtual tour, or would you be able to offer a virtual tour instead of, I guess, the in-person one?
I was looking into that. Absolutely. I'm going to do that. Yeah. And if somebody asks for it, yeah, it definitely, I think, is going to help. I was going to actually post a quick tour on my website shortly. Yes. Yeah.
Oh, that would be great. I think a lot of people would love to
Yeah.
see like what the machine looks like and your space. And I know that they would probably love to see, that meadow or wooded area that you told me about, where, for animals that like you've helped that didn't have a home to go back to, that you've been able to spread their ashes and stuff. It's just amazing. Did anyone else have? Oh, Liz, did you want to say
Well,
something?
I have two things to add. One, I did tour Barry's facility in January, and I did some Instagram stories about everything. So that is on my Instagram, saved in the highlights, that if that was helpful to anyone. We're at Sunset Vet Care. And then along Michelle's lines, where she was saying that she offers consults to provide resources. I might not have a consult, but I do have resources listed on my website that might be helpful for families during planning. And then as well, my wonderful care coordinator, Nicole's in on our chat here, and she'd be more than happy to help anyone out that gives us a shout, to help guide them to some of those resources. So.
Thank you so much. And yes, when I post this on YouTube, I'm going to add all of the contact information for both Barry and Dr. Liz. And for those that are in attendance today, I'll be happy to send you that email link with all that information as well, so you can contact them directly with any other questions you might have. And so does anyone have any other questions at all about what animal death care might look like, or anything that you wanted to add at all?
I have a question, Michelle.
Of course.
It's Jackie.
Hi, Jackie.
Hi. I have a question for Barry. What do we do, or what would a person do, like for planning, if your pet dies when it's unplanned and you're at home and you have a deceased pet? Like, would we transport the pet to you, or like, was there like a time frame?
I don't have any set hours at the crematorium. I understand accidents happen at any time. So there's two things that we can do, whether you can bring the pet down to the crematorium and use the facilities of our mourning room and so on and such, or I could pick them up with a phone call. I've been down to emergency clinics within an hour and a half to pick up the pet when there's accidents been happening. So I could pick it up also. A small fee that I have to charge for the pickup, especially at that time. But definitely, I could call and be picked up. Some people are okay with bringing the pet, and some they just can't. So
we can transport the pet to you, and it can be like middle of the night or whenever.
Absolutely, yeah,
Okay.
absolutely. Like I said, I don't have any set times. It just you can't plan that 8 to 4 thing, right? So
when my pet died, I knew he was dying, but the day he died, I didn't expect it to be that day. And I didn't know of you at the time. So I was like watching the clock, knowing I had to get him to the local crematorium by 5 o'clock. So it's good to know that there's another option.
Yeah, like I said, there's no set time. It just, I try to accommodate anything I can, yeah.
Okay, thank you.
Thanks, Barry, and thank you, Jackie, for your question. And Natasha has a question now.
Hi, I just wanted to offer support to Barry's facility as well. I've recently done a tour. I'm a veterinarian here in the Winnipeg area as well, with an interest in end of life care and death care. So I'm excited to be part of this Zoom for the first time. But I just wanted to draw upon my own experience recently. My cat actually suffered a traumatic accident. And I just wanted to speak to how much pre-planning probably would have saved me a lot of stress. And I didn't realize the benefit of doing that, despite being in the industry all the time and helping people make decisions towards the end of their the life of the patient. So in retrospect now, I've learned a lot from that, and I will definitely be advocating more strongly for pre-planning now, having lived through it myself. But I also wanted to mention that although this may not be the right approach for everyone, I found it very healing when Wendy died, to be able to hold her and be with her for a little while. I did not feel a rush per se to get her anywhere. And although I really appreciate that Barry can be available at a moment's notice for people who are not as comfortable having time with their pet after they've transitioned. I wanted to mention that because I think in my experience as a veterinarian, people don't realize that they can actually spend that time, whether it's at home or in a clinic environment, after their pet has passed, still with them, and to sort of feel what they need to feel with their pet still present, but in a different form. And I didn't realize myself how healing and important that was to my experience with her. So just as an aside, it's not relevant to everyone. Not everyone's comfortable with it, but it's not something that I think should be overlooked or obviously, frowned upon. So if you work in a clinic or you're around people who maybe feel that that's something that makes them a little queasy, or they feel that it's weird, I think having a heart-to-heart conversation about how meaningful those kinds of experiences can be and how it's a different experience for everybody. It doesn't have to be, right off to the aftercare providers. it might go a long way. You'd be surprised. So
Thank you so much for sharing that. And you're right, it's absolutely important that we don't feel rushed. And so I wonder if Dr. Liz would like to share a little bit about like right after our animal companion dies, what does that look like in terms of what can we do to spend that time with them? Maybe like obviously when an animal passes, much like with humans, I mean, there's certain things people don't expect unless they work in death care. You know, should we have a specific type of towel ready to, you know, wrap around a certain area, or like what would it look like if you were to say, if someone says, I would like to spend the next, you know, the whole day with my animal companion before I take them someplace, what would you suggest?
Yes, and I thank you so much, Dr. Natasha, for sharing that, because I think that is really important. That and even mentioning how, you know, just mentioning that to other people that you may know in the industry, because I worked in clinic for a very long, well, a reasonably long time before offering exclusively house call. That there are lots of different opinions, and I think unfortunately sometimes, because it's a full service scenario where you have to then, you need that person out of that room so you can have someone else coming in with their puppy vaccines, that we lose a little bit of our humanity a bit in offering that space for families. But I have now, since being able to offer in home care, I do find that it does allow for people to express their grief a lot more openly, I would say, and to be able to have that more time. It hasn't come up too often where people do want to have their companion home with them for longer, but I'm certainly open to it. And Barry has assisted me with a companion where the family chose to have him at their home for multiple days before they were prepared. Her wording to me was, I was ready for him to pass today, but I wasn't ready for him to leave. And I think that that's really important for us to be able to recognize and respect that, because my opinion is, if you're not doing harm to someone, I'm very open to whatever it is that people request. I think for things for people to be prepared. So as the body kind of transitions, so like I mentioned earlier, my first step is that I do provide sedation or pain relief anesthetic so that they're very much asleep. So before we transition with euthanasia medication, I'm checking for reflexes. I'm checking to make sure that the body is fully relaxed. So for most people, they'll be looking at their companion and they'll look fast asleep, but not rousable. So if they went to pet them or touch them, they're not lifting up their head, or their skin's not kind of reacting to that touch. The next step for them, though, is that as the body is responding to the euthanasia medication, typically it's within a few minutes that they pass. But I have had some where, you know, I say it's, as much as there's a science to everything, at the end of the day, each body is an individual, each being is, and there becomes a little bit of an art to end of life care, especially because the body is, I'm just helping speed up a process that's already occurring. So as the body is dying, there's the way that they're going to, you know, maybe be able to handle the medications might be, they might handle things faster or slower. So there's a little bit of an art, and that's just a kind of allowing them to respond to things as they're going to, and that's just to support them and make sure that they're as pain-free and as stress-free as possible. The most common things that happen when animals pass, which I think are probably very similar things that happen in people, we tend to see some changes to the breathing. For some pets, there's no changes. They're just breathing slowly and then it just stops. Some of them have some really big breaths followed by small breaths, which is very common breathing changes during natural death, where we'll see big, heavy breaths followed by fast, shallow breaths. and kind of going in this intermittent fashion. Sometimes I find some dogs almost look like they start to kind of pant a little bit right before they pass, but they are very much asleep, and it's not a stressed response. Again, it's just that normal changes as the body is getting ready to kind of stop that breathing function. A very common thing that I think upsets a lot of people if they're not prepared for it is that eyelids do not close most of the time. Sometimes if they already have their eyes closed at the time of administration of the euthanasia medication, they will stay closed, but I find even those sometimes do slightly open their eyelids a little bit. A lot of people will mention to me like, oh, he always sleeps with his eyes open, so I'm ready for that. But for a lot of people, they don't want to see the face then, if that's going to be something. So I think it's really important to let people know that that is going to be something that not to expect their eyes to close, because I think TV unfortunately has ruined that a lot too, that people die and immediately they close their eyes, which is not necessarily a normal reflex. One of the probably more difficult things, which you mentioned, Michelle, too, already about having items prepared, is that because the body is relaxing, the muscles are relaxing, the energy is leaving, there's muscles that are used to help hold the bladder and the bowels. So when those muscles relax, it is very common that our pets will urinate or defecate. So when I go to homes, I always bring pads with me to place underneath them to make sure that we can be protective of our surroundings, but also so that it's easy for us to still give them some dignity, that's a bit easier to kind of clean them up instead of leaving them sitting in their own waste. There's lots that doesn't happen though, but there's some where it's, maybe they haven't been able to walk very well and they've just really been laying in one spot for a few days, that they haven't voided very much, that we can get a lot. So I would say that's not a reason to not place them somewhere where you want them to be, but just to be cognizant that we can have some extra fluids that do require some cleaning. Most families, I think, prefer to have their companions on some sort of soft surface, though. So whether that's on a blanket or their own bed or things like that, but just being prepared for those changes.
Thank you so much. That's very helpful. And there's a lot to be said about also looking at like rituals. Just like with humans, sometimes we plan for right after death has taken place. And so for humans, we often, we will, we can watch the body, we can do, sometimes people do something spiritual, other times, we just want to spend time with the loved one. With animals, there's no reason why we can't also do something that's, whether a ritual or some sort of ceremony, we can make it as meaningful and purposeful as, as unique to each family as it can be. So I like to give options about, things that we can do, things that we can either prepare for, or even in the moment. If someone said, I don't think I want to do anything, but, death has taken place, and now all of a sudden they can feel that energy shift where, they say, I would really like to do something before we say goodbye or before we let the body be taken. And so, these are other kind of conversations that we can have, whether in the moment or while we're planning all of this. And, we can talk about, what you might want to do with the remains that you might receive from Barry. Some people want to hold on to them for a while, or, there's all sorts of beautiful creative jewelry that can be made nowadays. And some people like to plan a ceremony, and, that's something that we can always discuss and make it, again, as special and as meaningful to you as possible. And so death care isn't just literally, from the moment of receiving a life-limiting diagnosis to the time of death. It's before we receive that diagnosis, and until well after that death has taken place. And there's so much support that is available to everyone, and guidance and people who have experience to help you along every step of that journey. It's just a matter of getting, to know what is out there, what's available to you, by hosting sessions like this. And so I think it's been great. The questions have been wonderful. I'm so grateful to Barry and Dr. Liz for all of the information that they've shared today. Before we end today, does anyone have any other things, whether a comment or something that they really enjoyed learning about, or even a question for one of us? Oh, Heather, go ahead. You can unmute.
Hi, everybody. I want to say I really appreciate what you're doing. I have experienced the at-home euthanasia with my dog about three and a half years ago, and it was actually very calming for me to have that opportunity to have that. So I really appreciate that that's available. And I don't actually live too far from Lac du Bonny. I'm about a half an hour away from you. But I do have one cat that was just diagnosed a few weeks ago with like sort of like, I have to make a decision, right? It's either lifelong expensive medication or and daily double dosing practices of everything else under the sun, or choose the the choice to make to end her life. But and then I'm caring for another critter companion who's close to 20 years old now. So I think for the last 2 years I've been sort of like, what do I do? And it's kind of like, I don't want to have to transport her, so I really appreciate that, Dr. Liz, that you come out to people's homes like that. That's amazing. I just really wouldn't want to transport her. I wouldn't want to put her through that stress. So it's either I have to decide whether to let her just live out her life on her own in the time she's ready to go. But the other cat, I might have to make that decision. So, I mean, I think that it's great that Barry, you have this alternative option to cremation, to fire cremation, because I was sort of on the fence about that too, whether I wanted to do burial in my yard because I have a big yard, or to do a cremation. So I just wanted to thank everybody for having this opportunity, and thank you, Michelle, for hosting. And I did have a question about I don't know how busy you're going to get, Barry, like what your plan would be if say you got overwhelmed with sort of a backlog of work. What would your plans be for storage of animals? Like, so you're not in that position of, having to sit with the animal for a week or so, right?
The nice thing about my machine, the capacity is up to 400 pounds. I guess I should have said that in the introductions. My machine is able to carry up to 400 pounds. Each individual compartment, I can hold up to 14 animals if they fit in the individual compartments that I have. So
Okay.
it would have to be, I can do quite a few animals as long as the weights aren't too big. Right now I'm doing 6 at a time. Each individual compartment is ran, and that's what this process will be including in. So it all depends on the size of animal, and how often my pickups are and stuff is what I can do on a daily basis.
Okay.
But yeah, like it's the same thing with flame cremation and what his storage is, and just like in vet clinics also, when you take your pets to vet clinics, usually they're gonna have to stay in a cooler for a while until pickup, right? So it doesn't decompose and everything like that until the crematoriums can pick them up. So I have the same type of thing.
Yeah, the vet that came to my house, he was able to take her back to his location, but then she was kept in the freezer, or the fridge or whatever for like 4 days. So it was kind of like, that didn't sit so great with me, the fact that she was just gonna whisked away, and I didn't have control over what was happening after that. So I like this, that I would know, I could be more in control of that, right? I would be more of that process and more part of that, right? I can transport my cats to you or whatever if I had to, right? So yeah,
Absolutely.
Yeah, appreciate what you're all doing. Yeah, thank you.
Right. I just want to make one comment about the storage, use of cold storage for bodies. And I think for all of us, that's not, we would really prefer to be able to have our companions go directly from our home to the crematory in all situations, but there are times when that cannot happen. But I think that's pretty similar with people as well, that I don't think that people necessarily get cremated immediately. And in those occasions, I do have to keep them in storage, that everything is done as respectfully as possible, and how I would handle if it was my own companion, what I would expect for them. And then I saw a comment, I guess, that was asking between me and Barry about if Barry comes to the appointment or if I bring them home. And it really, it depends. Typically, if it's a large dog that I can't lift easily, I kind of set my limits probably around 90 pounds to lift with one assistant. That over 90 pounds, I'll have someone come meet me directly. But there's other times that Barry's come to meet me when they're smaller, I think, too, Barry. And then the other one was, you have a pet that was, oh, hi, Leanne. Oh gosh, I'm sorry about your dog. Is that Peanut? Oh gosh, okay. Example of how the process between Michelle and then me and then Barry, oh, Peanut, how, who to call first and what could look like. I think exactly in that order probably would make the most sense, to go talking with Michelle. And I know, Leanne, you know how to get a hold of me. That I'm happy to talk to you outside of this space too, to go into more details for those things.
Thank you for your question, Leanne, and I'm so sorry to hear about Peanut. And thank you, Dr. Liz, for answering those questions. Yes, absolutely. It makes sense to, you know, whether it's even just to get information or whatever. I mean, you can talk to any of us at any time, but if you were if your animal companion is facing life-limiting illness, it, you know, makes sense to talk to, you know, to do a first, possibly, or depending on where you're at with everything, talking to Dr. Liz, or even at the same time. It's not a matter of who to call first. Sometimes it's a matter of who do you want on your team? What do you want this to ultimately look like? How much support do you need or do you want on this particular journey? And so it's entirely up to you, you know, how many people you call in or not. But I think it's nice to at least know that there are those options. It's you know, to have, like, say for someone like me, obviously I can't provide medical support, but I can be there every step of the way, you know, to support you well before that journey takes place, for, you know, for Peanut or for any other animal companion. So having that support, someone to talk to, and I also offer bereavement support often. So, you know, to have someone who's there with you as that support, a listening ear, someone who can provide resources, this can go a long way, you know, before, during, and after. And so I hope that, you know, people start to realize that, and there are other animal companion death doulas out there. You know, we're emerging. It's really something that, you know, we're trying to help people understand that death obviously is a very natural, normal process. It's just not talked about enough, and it's become so impersonal in a lot of ways. And so it's so important to understand that we're not trying to run the show. We're not trying to tell you how it should be, or, you know, anything like that. We want to help you have it the way you want it to be, by empowering you with education and options and resources, everything that you need, giving you what you need, the tools, the you know, and the experience that we have to help you create what is meaningful to you at that time in your life. So thank you all. We have time for one more question, if anyone has. And like I say, I'll be putting this on YouTube. Everyone that's here is going to receive the link for that, as well as all of our contact information. You know, if you are on social media, please like Sunset Veterinary Care, as well as Peaceful Pasture Pet Cremation. I got it, Barry. And of course, myself, the Spirit Guided Path. And so we all like to update with not just pictures, but also information. I'm always posting about advanced care planning, both for humans and animals, and all of that. And you know, this is what I like about having these kind of conversations. You see that we can work as a team. You have people who each carry their own different services and expertise, their experiences, what we can bring to you and to your family to help support you during what is always going to be a difficult time. So with compassion and just resources, all of that can be faced a little bit differently than maybe it was in the past. Do we have any more questions before we say goodnight? No? Okay, so I want to thank everybody for being here. I hope that you found this this conversation informative, and we look forward to hearing from you. Thank you again, Barry and Dr. Liz, for being here. It was wonderful to have this conversation with you, and of course, we'll be in touch. And I want to wish everyone a wonderfully peaceful weekend.
Thank you so much, Michelle, for organizing and hosting.
Very welcome. Okay, guys, take care. It was nice to see you.
Yeah, thanks,
Thank you, Michelle.
everybody. Have a good night.